Welcome back to Links 24 and welcome to the April edition of Whitney's Healthcheck, sponsored by Tomah Memorial Hospital. I'm Whitney and I'm joined by Tomah Memorial Hospital Specialty Clinic Doctor, Dr. John Robertson. And we'll be talking about wound care, when to self-medicate versus when to take a trip to the clinic. All right, thanks so much, Dr. Robertson, for being here.
You're very welcome.
All right, so before we jump into this, I mean, what is a wound?
So anytime you have a break in the skin, so if you have a fall or a surgical incision, that would be a wound at that point in time.
Okay, now I'm not just gonna like skin my hand and come into the clinic. So at what point, when do I need to be seen for wounds?
Right, so if it doesn't go through the normal stages of healing where it develops a scab, and then over a period of time, let's say 7 to 10 days, that scab should then heal underneath and then fall off. But if the scab doesn't form, and there's a reason for it, there's other conditions as diabetes in terms of diabetics, or
so some people don't heal as fast as other people.
Correctly. And the other thing that can happen is that they develop infection. So infection can lead to a problem in healing.
Okay, so now we've got some pictures and stuff here, but what would you say are like some of the most common wounds that you're seeing come into the clinic?
So some of the most common wounds we see are like for venous disease. And so venous blood is the blood that's taking blood from the organs and bringing it back to the heart to be reoxygenated.
Right?
So in your veins versus arteries. And so with venous disease, you can get what we call venous stasis ulcerations. And the venous disease occurs because what you have is the veins aren't functioning properly. And when they don't function properly, you get congestion in the lower legs. So you can develop swelling, you can get and the swelling then can lead to your epithelium, the skin becoming very thin, so that if you brush up against a table, instead of causing a little scratch, it'll open up a wound. And then that wound then can progress to become worse.
Okay, so we've got some pictures of that. And you mentioned this, the venous stasis, right? That's what you call it.
Now, some of these pictures are a little...
Yeah, this is a little bit graphic here. Right, but this is examples of that.
So this is an example of a individual with a venous disease, and that's just showing you the congestion. And the congestion, patients will present with pain, aching, cramping legs, venous changes to the skin and texture to the skin, so you get the discoloration. And this is the swelling that you see, and then that swelling can then lead to the development of an ulcer. Okay,
so now this is an ulcer, right? This is like, is that
so this
is
a beginning of an ulceration. It's very superficial. And
beyond the top of the surface.
Beyond the top. And then what will happen is that individual will notice that it's not healing over a period of time. And then this gets larger.
Which is kind of what we have here, the progression. Right. So now when these wounds, so say someone comes in the clinic with wounds like this. Right. So they've gotten bad, they can be painful. So I mean, what can you do for them? So
what you're doing, there's a number of different things, both conservative therapy and leading all the way to surgical therapy. And so initially what we would do is kind of clean the wound up, try to remove any infection. So we would do that with antibiotics. We'd do that with debriding agents to remove the necrotic debris that
so the dead tissue.
The dead tissue, correct. And then we would try to treat the venous disease itself. And so with the vein, there are two veins in each leg. There's a superficial vein and a deep vein.
So top and
right. So one's more anterior and the other's posterior.
Got it.
Right. And so then the more superficial one, we can actually do things to it because that's the one that causes most of the problems. And so we close that vein down. And by closing the vein down, since it's not working for you anymore, and therefore the blood is not going back to the heart, it pools in the leg. So we close that vein down by heating it up with a catheter.
So this can be actually done at the hospital?
Yes.
If anybody's having issues with wounds that aren't closing, they're not healing after a few days, and then after even up to a week where they're not healing, they could see you at the clinic or see their regular doctor to make sure they're getting these wounds treated so they don't get worse.
Right. And that's the key, is to try to prevent this from getting to this point.
Okay, wonderful. So if you're having those issues, definitely talk to your doctor, and then you can be seen at Tomah Memorial for some of these services.
Yes.
Awesome. Thank you. Well, we need to take a short break. When we come back, we'll be filling you in on what's coming up in your community. Don't go anywhere.